Nail anatomy. Nerves. The distal digits have a rich neural innervation since the fingers are responsible for fine tactile discrimination. The nerves innervating the nail unit mimic the arterial supply. There are paired digital nerves innervating the palmar and dorsal surfaces of each digit. The dorsal digital nerve branches and runs over the distal interphalangeal joint to innervate the proximal nail fold. The palmar digital nerve travels with the proper digital artery past the distal interphalangeal joint. It then trifurcates into branches that supply the rest of the nail unit and the pulp of the distal finger. Surgical considerations. Nail surgery needs careful consideration of the anatomy of the nail unit and its surroundings. Understanding the neural innervation and blood supply of the tissue can help the surgery proceed without complications. Before the surgery, once the nail has been thoroughly disinfected, an anesthetic should be used to ensure the patient does not feel pain. Any local anesthetic can be used, such as lidocaine, mepivacaine, or prilocaine. However, one author suggests ropivacaine as a preferred anesthetic due to its long duration of action, which can be helpful for patients since severe pain can follow nail surgery once the local anesthetic has worn off. There are many techniques for digital anesthesia. The proximal digital block is a common technique with great anesthetic results. It is useful for any nail surgery. However, if too much volume is injected, compression of the vessels may cause ischemia. Local injection around the nail unit can avoid this ischemic complication while still offering the advantage of proper anesthesia. Another option is transthecal anesthesia. This technique is useful for the second, third, or fourth digits. The local anesthetic is injected through the metacarpophalangeal volar joint crease into the flexor digitorum tendon sheath. This technique also avoids ischemic complications and damage to the neurovascular bundles in the fingers. To accurately diagnose nail disease, a nail biopsy may be necessary for pathologic confirmation. Punch biopsies are useful for nail bed and matrix diseases. A punch biopsy of the nail matrix should be no larger than 3 millimeters. Fusiform biopsies are oriented transversely in the matrix and longitudinally on the nail bed. Due to the delicacy of the matrix, it should not be squeezed during biopsies or cut during suturing. Lateral longitudinal biopsies are taken from the distal interphalangeal joint to the hyponychium just medial to the lateral nail fold. This technique leaves the lateral nail fold intact and ensures no matrix remnant is left behind. Since the nail grows over months, this biopsy technique allows the assessment of the progression of the nail disease. Biopsies of pigmented nail streaks are of utmost importance to rule out the possibility of subungual melanoma. A specialized technique has been developed to acquire an adequate superficial nail matrix biopsy to diagnose melanoma while preventing post-surgical nail dystrophy. The proximal nail fold is incised and retracted to expose the proximal soft nail. The soft nail is then cut and elevated to expose the pigmented matrix underneath. A very thin piece of pigmented matrix tissue is removed and sent to the lab for further evaluation. The nail plate and proximal nail fold are replaced and closed with either a suture or suture strips. The nails can be important clues to local and even systemic disease. Some description of several nail findings and diseases include leukonychia, or leuc meaning white and onychia meaning nail. White discoloration on the nail due to faulty keratinization of the distal nail matrix, since the distal matrix produces the ventral nail plate. Transverse leukonychia, also known as Mees lines, are transverse parallel white bands in the nail. Repeated systemic stressors may cause this finding. Longitudinal melanonychia. Melano meaning dark pigment and onychia meaning nail. A band of dark pigment in the nail due to the presence of melanin in the nail plate. Benign pigment changes can be difficult to distinguish from ungual melanoma. Therefore, a biopsy may be necessary for final diagnosis. Onycholysis, onycho, nail, and lysis, meaning loosening, occurs when the distal nail plate is no longer securely attached to the nail bed and other supporting structures such as the nail folds. Onycholysis can be caused by trauma or may be associated with many cutaneous conditions like psoriasis and onychomycosis. Onychomadesis, onycho meaning nail, mal meaning badly, and desis meaning bound. Shedding or separation of the proximal nail plate from the proximal nail fold. It may be due to complete cessation of both the proximal and distal nail matrix caused by systemic stressors or trauma. Onychomycosis, onycho meaning nail and mycosis meaning fungus, presents as thickened yellow discolored nail plate caused by a fungal infection of the nail and its surrounding tissues. While it is most commonly affects the toes, it can also affect the nails of the scissors. Onychorhexis, onych meaning nail and orhexis meaning rupture, longitudinal splits occurring in the distal free edge of the nail. Onychoschizia, distal transverse lamellar splitting of the free edge of the nail due to breakage in the intercellular adhesions in the nail plate. Paronychia presents as inflammation of the nail unit with possible surrounding crust and pustules due to infection of the nail folds. Trauma and manipulation of the nail folds and cuticle can cause loss of their protective effect, leading to a risk of bacterial colonization. The most common cause of acute paronychia is Staphylococcal aureus. Squamous cell carcinoma presents as an erythematous mass that can disrupt nail morphology, commonly mistaken for a benign lesion such as verrucous lesions, onychomycosis, or amelanotic melanoma. Treatment involves Mohs surgery and possible amputation. Subungual hematoma, painful red to black discolorations caused by bleeding of an underlying vascular bed, caused by trauma. If associated with severe pain, nail puncture can be performed to release pressure. Nail abnormalities associated with systemic conditions. Clubbing, convex appearance of the nail that is caused by thickening of the nail bed soft tissue, commonly associated with vascular pathologies including cirrhosis, COPD, and celiac sprue. Coileonychia, coil meaning concave and onychia meaning nail. Thin, spoon-shaped nails due to abnormal nail matrix function. Although this can occur in normal individuals, it is a sign of severe iron deficiency anemia. Additionally, it can be associated with hemochromatosis, trauma, Raynaud's disease, hypothyroidism, and systemic lupus. Pitting, punctate depressions on the nail surface due to abnormal keratinization of the nail plate. Problems in the proximal nail matrix manifest as nail pitting, since the proximal nail matrix is responsible for the formation of the dorsal nail plate. Nail pitting can be seen in psoriasis and alopecia areata.